India has reported the world's highest daily count of new coronavirus cases for a second straight day. More than 330,000 new infections were recorded in the last 24 hours there. In response, Canada is banning all flights from both India and Pakistan, and the UK is also putting new restrictions on travel to and from India. The unprecedented spikes comes after coronavirus case numbers first rose to 100,000 per day by last September and then dropped off again through the winter. Experts say that new virus variants and recent superspreader gatherings have contributed to the latest surge.
Ambulances lined up outside hospitals that can't take any more patients. Oxygen shortages that have pitted different states against each other. Doctors and nurses pushed to the limit as they scramble for resources.
The supplies that are coming in, which are very irregular and uncertain, there is a lot of tension in the system. We are not able to fully focus our energies on the clinical part of it.
Lines are hours long at testing sites. After many months of relatively few cases, this comes as a shock here. I've been waiting outside the testing center all day, and we are yet to be tested. I just pray to God, because if we are tested positive, then where will we go? We are helpless. Epidemiologists say India missed crucial opportunities to prepare for a second wave. The government didn't hire more doctors and nurses, and it allowed massive public gatherings, which may have been super-spreader events.
We were lulled into a sense of complacency because the various measures of the pandemic, whether it was the daily case count or the daily death count, or even the test positivity rates, all of them started declining from October, and by early January, you saw them plummet to very low levels. And then there was this feeling, propagated even by experts, that we had actually attained herd immunity.
Last week, the government said it would allow a greatly expanded list of vaccines to be used, but it faces the mammoth task of vaccinating a population far bigger than the European Union and the United States combined.
For more on this story, I'm now joined from Delhi by Dr. Shushin Bajaj. He's the founder and director of the Ujjwala Chignis chain of 13 hospitals across India. Dr. Bajaj, in our report, we saw that doctors are scrambling for the basic necessities to care for their patients. What can you tell us about the situation in your hospitals?
Well, it's quite apocalyptic, if you can say that. It's not just the second wave, it's the tsunami that has hit us, and it has hit us very badly. We are running desperately short of beds, desperately short of oxygen, essential medicines. We are turning away patients. It's breaking our hearts, but we can't do anything. I mean, there are so many patients on the road right now in ambulances for hours together. They cannot find a bed anywhere. And we have no choice because oxygen is in such a short supply. Otherwise, we are used to getting masses of patients. We do get waves of dengue, once in every 3-4 years, where our hospitals are working at 200% occupancy. But in those cases, usually it's not that, you need always an oxygen bed or an ICU bed. We can treat them on our couches as well, in the corridors as well. But this case, it's very different because every patient is needing oxygen and we can't really help. I mean, it's quite bad. Yeah.
So what do you need, you and other hospitals in similar circumstances right now, what do you need and who can provide it?
So first of all, we need oxygen supplies, assured oxygen supplies. They're in very, very great demand. Oxygen is at a premium. Many people are black marketing it as well, but it's in short supply, oxygen cylinders and oxygen itself. We need essential medicines. Medicines which are not so much essential also, like remdesivir, tocilizumab. We don't have any stocks. We are running out of stocks for even simple IV sets, cannulas. So the first thing that we are asking is ventilators, BiPAP machines, and oxygen supplies. If it is possible, none of them are available right now. Oxygen concentrators even are not available in the market at this moment.
Are you actually asking for international help?
I mean, I don't think I have a locus standi to ask for international help. I think the government of India has to decide, but I'm sure the government is listening to us, and if we can get assured supplies of oxygen cylinders as well as some life support machines and medicines, I think we can treat many more patients than we are treating right now. Many of the patients are waiting outside the hospitals. They are not able to get in because of the shortage of these critical equipments and oxygen supplies.
So, but you're saying the oxygen supply is there in the country, you're just not getting it, is that correct?
Yeah, there are logistical issues. Their cylinders are short. Some states have more oxygen supply than they need. Some are very short. So our hospitals in Delhi and Uttar Pradesh are suffering due to shortage of oxygen supplies, but other parts of the country do have oxygen supplies as well. I think these are supply chain issues because the demand has shot up unexpectedly and at almost 10 times the normal demand. So people are scrambling to meet it. I hope that we can sort these issues out in the next couple of days. But right now, it's a difficult position to be in.
Dr. Shushit Bajaj in Delhi, thank you very much for your time.
Thank you.